initial strictly containment strategy. Risk communication to the public and coordination with the state-level COVID-19 response preparedness groups are going to be scaled up. There's also an increased drive to detect cases more rapidly, especially in hotspot communities. All persons fitting the case definition are advised to first of all wear a mask of any type, isolate themselves from friends and family while they call National Emergency Number 112 or the NCDC toll-free number of 0800-97000010 or report to the nearest health facility for referral. The policy is to detect early, test early, and isolate cases as early as possible. I again remind all health workers in both public and private health facilities to maintain a high index of suspicion and to safely refer patients with fever and respiratory tract symptoms for COVID-19 testing. Safely refer here means that you offer a mask or some protective barrier, if possible, to the patient or the person and invite the person to a holding room if you have one, and then you call 112 or 0800-970010. A guideline has been produced by the Federal Ministry of Health Accreditation Committee to ensure that standards are maintained at all COVID-19 isolation and treatment centers across the country. There are 3 levels of isolation. Isolation 1 for suspected cases of COVID-19 who are awaiting test and result. This center will also be used as designated the mandatory quarantine facility for persons returning from abroad with negative results or those unable to self-isolate at home for 14 days. Isolation 2 is for confirmed COVID-19 cases with mild or moderate symptoms who need little or no clinical management and only need to be isolated from community for the time they are infectious. Isolation 3 is for confirmed COVID-19 cases with severe or critical symptoms who need enhanced clinical management or intensive care. In Abuja, for example, the designated Isolation 3 facilities are the University of Abuja Teaching Hospital and the National Hospital. There are 4 Isolation 2 centers. I appeal to citizens to comply with invitations to isolation centers. This is your best option of recovery and for detecting possible complications in time. I wish to thank the professional health associations that have pledged their support in filling health human resource gaps. We have met with the Nigerian Medical Association, Pharmaceutical Society of Nigeria, the National Association of Nigerian Nurses and Midwives, the Medical and Dental Consultants Association of Nigeria, to position medical and critical care specialists for deployment as when needed. The Nigeria Center for Disease Control has now issued a comprehensive guideline on the use of masks, including improvised and homemade cloth masks or face coverings like handkerchiefs or scarves over the mouth and nose, which guard against particle emission, even in conversation or when coughing or sneezing, and may offer mutual protection to the wearers. it bears repeating to again recommend that the masks be worn. One, as an additional layer of physical protection where close contact or crowd may not be avoided with certainty, such as in a market, or when somehow or the other you find yourself in a crowd. They are particularly recommended for food vendors. Also, to wear masks will be elderly people or people with pre-existing medical conditions whose health condition can be regarded as fragile. I must emphasize that masks must be worn in combination, but not as a substitute for hand washing, physical distancing, and good respiratory hygiene, as well as sanitization of surfaces. Medical grade masks are best reserved for patients and health workers who need them most, especially with the globally limited availability of personal protective equipment. Citizens are encouraged to make use of improvised or homemade washable masks or face coverings, which should be properly washed daily in warm water and dried or ironed. Yesterday, we received offer of technical support from the US CDC, already announced, and a large donation from the United Nations Agency of supplies and equipment that included 50 ventilators. This increases our inventory of essential equipment. The government of Nigeria thanks them and is grateful for such good friends and partners. Finally, I wish to commend all Nigerians for their sacrifices and the understanding as we work to ensure that we control COVID-19. The inconveniences that arise will be well worth it. With the present trend towards community transmission, the strategy of the health sector is being redrawn to address the specific challenges, and their emphasis will be increased towards screening, testing, and immediate isolation of confirmed cases. The advisories on non-medical interventions must be maintained, which have already been well publicized. Please continue to trust scientifically proven advisories and ignore fake news. I shall now hand over the desk to the Director General of CDC.
Thank you, Honorable Minister, Chair, Honorable Ministers. Thanks again, ladies and gentlemen of the press. Thanks again for this opportunity. I'd like to start from where the Honorable Minister stopped and really focus that we're really trying to change our strategy now and test more people. The testing lab capacity in our labs has increased. The bottleneck now is getting the samples from the right people. So we're setting up 20 healthcare facilities in Lagos, supporting Lagos in doing this. This is done by the government of Lagos State to collect samples from people that think they have an acute respiratory infection, have fever, have samples, and want to go to a healthcare facility. We're intensifying our surveillance in healthcare centers, so hospitals around Lagos and the FCT, to collect samples from people with an acute respiratory infection. In Abuja, certain communities, we're going door to door to collect samples from people that have an acute respiratory infection. We're doing the same in Lagos. So in these two states where there's a high incidence of infection, we're now strengthening our surveillance and going to the patient to collect these samples. The call centers have improved dramatically, so we're also urging members of the public that think they have an acute respiratory infection to call us. We will send a team. Please don't go yourself. If you're going, go to one of these 20. Don't go to any other center. We will announce them as they're set up. Lagos State will announce them and then make them accessible to everyone. The key topic I've picked today, like you would have noticed from what I'm wearing, is the topic of masks. This has been a controversial issue, but actually it doesn't need to be controversial. First, let's start from some basics. The number of cases across the world has really risen to over 2 million. So we really have to imagine 2 million cases, over 100,000 deaths of a disease that none of us knew about 4 months ago. So the scale of the disease and the outbreak and the scale of the response has to radically increase. Science is evolving every day. We're making new discoveries in terms of how to manage various aspects, and the aspect of mass is just one of them. On the other hand, there's a reality that we face. There's a chronic global shortage of personal protective equipment, including masks, around the world. Everybody is looking for the same thing. The world was not prepared for a pandemic of this scale. So we have to prioritize certain parts of our population. 50% of all the masks in the world are produced in one country, China, that has been locked down for months. They're now restarting their production, and thankfully some of those things are coming out. A lot of the PPEs are produced in countries that need it themselves, so have themselves banned the exportation of a lot of these things, including masks. So the demand is very high, and even with a lot of resources, a country like Nigeria is not able to meet the demands of everyone. So there's no way we can supply masks to everybody in Nigeria right now. So we've had to come up with a policy that is pragmatic. And if you have seen this policy, it's been on our website for a few days now. I hope you've all read it and digested. We have 5 key recommendations. I'll actually recommend that website to anyone that wants to find out about specific things about the response. So I'll crave your indulgence and read the 5 recommendations because they're very important. 1, the wearing of masks or equivalent is recommended as an optional additional layer in addition to measures like social distancing, physical distancing, hand and respiratory hygiene measures. So this mask, like the Honorable Minister rightly said, is not to be done in replacement of, but in addition to all the other measures that we have recommended in the past. However, it is critical that we learn how to properly put on the masks and take them off by their hands. Once you touch the mask, especially when you touch the inside surface of the mask, that's exactly where we don't need you touching, because that's exactly where the viruses that we exhale are. So please, what we call the donning and doffing, the putting on and off of masks, is probably more important sometimes than the wearing of masks, in order not to increase the risk. When we say improvised masks are an option, they are an option. But they're not an option if you're going to wear the same cloth mask every day for the next month. You have to wash these as frequently as you can possibly do, at least once a day, for it to make any sense at all. And this is the advice for people that are not working in the medical field. The usage of masks, number 2, is particularly important if you have to attend a large mass gathering, which are very few now, if you want to go to the market, to the mall. And, the science behind this is, the evidence that we have at the moment is the mask is protects those people that have the disease, might be at early stages of it, or asymptomatic from spreading. So it's very important that if you're in a mass gathering, in order to protect others in a situation where you may have the disease, that you wear a mask. Now, one key thing is we're asking that all public sector resources be reserved for procuring masks for people working in the health sector. So we're really appealing to the state governments across the country. If you have extra funds to procure PPEs, please use it first to satisfy the need in your hospitals and your clinics before you start procuring masks for everyone. Let us protect the most important people in this war, the people on the front lines. So really, we are trying very hard to meet the demands of healthcare workers and prioritize them. Like I said, the wearing of mask number 4 will not protect against COVID-19 unless it is combined with other measures like physical distancing, hand washing, respiratory hygiene. And finally, that we particularly recommend this for senior citizens, age over 60 at least, especially those that have hypertension, diabetes. Many of us have this. We live more or less comfortably with this, but the fact is that we are an additional risk of having a severe incidence of this disease, so we like to offer that additional level of protection. So to conclude, we have ensured so far that we meet the demands of hospitals across the country in terms of their PPE needs, and states we've distributed, and in some cases like the Jack Ma donation actually made completely public who has received what. We made this public on our website in detail, what state has received what, obviously prioritizing the states that have the most cases. We're really looking for local manufacturers of this to procure from them. So every hand sanitizer procured by the federal government now is supplied by a local manufacturer. As far as I know, everything we buy at NCDC is supplied by a local manufacturer. So there is an opportunity for industry to scale up the ability to produce masks, the protective equipment that we wear, as long as it meets safety requirements that we have. So really, this is an opportunity. In every crisis, there will be an opportunity. This is one to really scale. And I have a feeling that the need for PPEs will change forever in our country. And so if you develop a production line, this will be a great business to be in. So we can solve two problems, one of the healthcare sector and also support the economy. If we do this, those people that are right now hoarding masks, and there are many of them, will let go of them because industry needs to respond. If industry can respond to our needs right now, we'll put out of business all those people keeping masks, waiting for prices to go up even further. And that is really our goal. We want to do the right thing. We want to support the Nigerian economy and grow as we keep ourselves fit. So if you're a member of the public and you want to wear a mask, you don't have to wear a medical mask. In fact, we don't recommend the use of medical masks for members of the public. We recommend the use of improvised cloth masks to protect you if you insist. So thank you very much.
As the chairman of the Presidential Task Force, honorable ministers, members of the Presidential Task Force, ladies and gentlemen of the press, good afternoon. So today I'll be talking about a few things, but in particular the issue of effective partnership. I would like to start by appreciating our partners, individuals and private organizations that have continued to provide support towards the response. I would like to in particular name NEMA for helping us with ambulances, INEC, NIMASA, the Nigerian Communications Commission, the Federal Ministry of Communication, Nigeria Orientation Agency, the Nigeria Economic Summit Group, and others too numerous to mention. I would like to applaud in particular the synergy of federal government agencies as we continue to work together, long hours away from families, away from friends, in order to get on top of this epidemic. Thank you. I would also like to thank state governors. Today we had a meeting with the Nigeria Governors Forum. It was a very productive meeting. We all agreed that we needed to improve coordination and synergy between the federal and state governments. We need to provide a simple message to our communities on the need to protect themselves. We have also agreed to have more effective logistics to identify assets within states that can be used for the purpose of the pandemic, and to also work closely with the private sector to provide a more sustainable arrangement for the health sector in the future as we emerge from this pandemic. I would like to briefly again mention the issue of Ramadan, which I spoke about yesterday. The task force continues to work very closely with the Nigeria Supreme Council for Islamic Affairs and with other Islamic organizations in preparation for the upcoming Ramadan. I would like to emphasize and plea for our communities to please maintain physical distancing and prevention measures during the period of Ramadan. We need to be alive and well in order to be able to pray. If you are sick, you will not be able to pray, and neither would you be able to pray if you are not alive. Finally, I would like to mention those that have been diagnosed positive with COVID and send out this message of hope in these dark times. We must not despair. We must keep hope alive at a time of difficulty, and we must emerge stronger. But we can only do so if we continue to work together. Thank you.
Thank you very much. We have taken the update. We shall now take the questions. We have a maximum of 7 questions for today, and we'll take them in successive order.
Good afternoon, members of the Presidential Task Force. My name is Yemi Adebayo from AIT. I just have 2 questions for the PTF today. The first has to do with, I think the PTF National Coordinator would want to answer this, or perhaps the SGF. When the presidential lockdown was announced, government did say that import and export operations will continue amid the lockdown. But there have been complaints by some importers who are having challenges. Their goods have arrived, but they cannot pay for import duty due to the fact that banks have been shut in some of these affected areas. What is the PTF, what intervention is the PTF going to make on this? And if it's that the ports that are open are only for essential services, I would want to know these essential services, if those that have probably that have goods like office machine and stationaries, is it that their goods are going to remain there till the lockdown is over, or is government planning to give some sort of concession to them? You know, perhaps demurrage will definitely be occurring for them now. Is government planning to give some sort of concession to them? Then secondly, there have been a series of questions. Many people have been advocating, unions, medical unions, NANS and other organizations have been advocating that. Are there plans to have them represented in the presidential task force team? I will want the SGF to respond to this. Thank you very much.
Good evening, sirs. My name is Juliana Baloyen. I write for the Sun newspapers. The Minister of Information or the SGF might want to answer this. There are speculations out there that senators and House of Representative members were given between 500 million and 700 million to share as COVID-19 palliatives to their constituencies. Is this true? SGF, sir, the IG is not here. It would have been nice if he was here. Are you aware that people are resisting this lockdown and there are unrest states like Delta, for instance? SGF, sir, maybe this can be passed on to the humanitarian minister. Maybe tomorrow he will give us information. There are allegations that the grains released by customs for distribution are being diverted for personal use.
Good afternoon, sir. My name is Friday Okerigbe. I'm a reporter with Channels TV. I would like the NCDC boss to really respond to my first question. It has to do with the distribution of those who are positive, the confirmed cases in Abuja. Can we begin to have a bit of analysis about those who are confirmed in Abuja? Something similar to what Lagos State is doing. Without mentioning the names, they give the age demography of those who are confirmed. And also, they even go further to tell you where in Lagos some of these confirmed cases are concentrated. The reason is it will help residents to keep watch of perhaps the little places they go to. Can we begin to have a bit of such analysis? The second question has to do with, I would like the Minister of Health to respond to this. In the last 2 months, we'll be talking about what donors have donated, whether individuals or not. Not much has been said about procurement by the Ministry of Health. Remember that when the whole briefing started at your ministry, you did tell us that the president has released everything you wanted, you requested for. Is there any challenge you are having with procurement? That's why you're not telling us anything about what you have procured as a ministry. But you tell us every day about what United Nations, other donor partners have given. Thank you.
Good evening, sir. My name is Nike Adebowale. I report for Premium Times. So I have just one question for the Minister of Health. Sir, there are allegations that some private-owned hospitals are not complying with the federal government directive to report suspected cases of COVID-19. What are you doing, sir, to ensure they comply to these directives? Thank you, sir.
Good evening, members of the Presidential Task Force and Nigerians at home. Does NCDC have quality assurance for the test kits that it is receiving from various donors and it is procuring in order not to have wrong or misleading test results? And I want to also ask the NCDC of what is the NCDC's projection of contact tracing and case detection by the end of the 2-week extension? Thank you.
Good evening, Mr. SGF. Good evening, honorable ministers and my colleagues. Rachel Abuja from the News Agency of Nigeria. My question is for the NCDC DG. Sir, about 2 weeks ago, you said we had 5 index cases from Akwa Ibom. And just yesterday, we had 1 from Akwa Ibom. So I would like to know the state of testing and contact tracing in Akwa Ibom. Second question, sorry. Now that we have 4,000 tests per day, or we are targeting 4,000 tests per day, what plans do you have like for a long-term thing for Nigeria post-COVID? Thank you very much.
Good evening, sirs and all. My name is Abbas Adebowale Juma from Daily Trust. The first question is for the national coordinator. Since the Minister of Education is not around, Nigerians were asking questions that some of the schools that were being designated or actually turned to isolation centers, what is going to happen after the COVID-19 must have been taken care of with the students and children resuming back to the school, and if there is any other policy on physical distancing when the schools that are known to be largely congested resume. Then this also one is for the national coordinator. Yesterday, a colleague from China was harassed by the policemen. Today, the soldiers were mostly in charge of allowing vehicular movement. And they said that the instruction from their bosses did not include media, that they were mostly from security personnel like their own or health personnel. Can there just be a clear directive so that all these arguments on the road will be reduced and the congestion also will be reduced? Thank you.
Thank you. That's the final question for the day. The questions have been directed at the Honorable Minister of Health, the Director General, NCDC, the National Coordinator, the Honorable Minister of Information and Culture, and the SGF. We shall begin with the Honorable Minister of Health.
Thank you. I will address the questions one by one. The question of compliance by private hospitals, I am not aware of that. You say that there are allegations. I have not heard of that. But we have issued a lot of times advisories against trying to manage this highly infectious disease in a private facility where the rules and the guidelines for infection prevention and control are not obeyed or even applied. But we're not saying that private facilities should, but they have to be accredited to do it. The facility has to be inspected and certified as fit, and the doctors qualified to handle that, and they have necessary protocol in place to handle this case. Because the likelihood is that the spread of infection from one person who has COVID to other patients will be very, very easy, and even to the personnel, to the staff, to the nurses and so on, and even the cleaners. So I think there should be a report of such facility if you know of any. So again, we do highly recommend that all colleagues comply with that directive. As for the donors, there are many donations that have been made. Many have also been promised, and they have arrived at a time when we need them most. As I've said many times here, we are looking to have a good stockpile. We learn every day. We learn from what is happening in every country. We learn from what challenges other nations face. We know that in well-developed countries, very highly industrialized countries, are suffering from things as mundane as masks or even protective equipment. So if such countries are suffering from such shortages and having to improvise, in some cases using plastic bags, then we must really try to learn from that and stockpile. We want to keep as much as possible. That's why we welcome all donations, and we keep inventory of them very meticulously in our warehouses. But the procurement process for the government is ongoing. You know that has to follow due process, and the donations that we have received also just add to the stock that you're expecting. The processes are ongoing, and they have all been properly mapped out as processes permit. Somebody, I think Friday, wants to know the location of the persons who are positive. We have not really started doing that. All we know is that the grand majority of the positive cases in Abuja and the Amak region, Abuja Municipal Area Council, that's the large majority, perhaps with a few scattered in other places, but we have not done such granulation to show where one or the other leads. Perhaps the NCDC can speak on that, but I also want to use the opportunity to speak against stigmatization. So we don't want stigmatization going on, people feeling that this is something that is so terrible that you must be ashamed of it, or that you must not let people know. You know that in the UK, the Prime Minister made his own known that he was in treatment, and also the people as important as the Crown Prince and many other persons in America, they have said it. But the population should not drive stigma by wanting to know where people live so that you can avoid that area. So you take your own measures and do not contribute to using that as an excuse for creating stigma. As for the representation of professional bodies, yes, we have absolutely nothing against it. The more the ideas come, the better. We have a situation room at the Ministry of Health that hosts every day where the NMA participates. They already participating at that level, but even at the level of the technical working groups of the PTF, there's absolutely no objection to those who can bring in more ideas or probably other perspectives that others have not looked at. I think that's all that concerns the health sector, and perhaps the DG of NCDC will address the others.
Thank you. Friday has to remember, in addition, that despite our being here and briefing, the responsibility for FCT patients are actually FCT's responsibility, despite their being in Abuja. So that level of detail, it does exist, but it's for the FCT to share, just like Lagos State is sharing. They are responsible for the management of patients in FCT. But I absolutely just want to re-emphasize the point the minister made. This is a virus, it's an infectious disease. We have to also respect the people that get infected. It could be any of us. None of us in this room is immune to it. It's a new disease, so as we talk about it as if there are others, we should all remember that it could very easily be us. In terms of the question on Akwa Ibom, I think that was from Rachel. Yeah, contact tracing is intensive. We found only one more patient so far. So that's just the way it is. We have a team supporting them and they're trying very hard. Your second question is probably much more important on testing. So we've tested we now have the capacity right now of testing about 3,000 per day. That capacity is not being fully utilized. And that's really why I focused on Lagos State and FCT and the efforts they are making to get more people tested, more samples in. And that's why we're reinvigorating efforts to get to really, the bottleneck now is not the testing, it's collecting the samples from the right people and getting it into the lab. So that's where a lot of effort is happening over the last few days. End of today, we're going to publish a testing strategy, a diagnostic strategy for the country. So everybody is aware of where we are, where we're going, short term and long term. How we're going to introduce the TB facilities, the gene expert, how we're going to introduce the HIV testing, and how we are going to end up with one lab per state. So we're going to introduce all of that, make it completely public. We have a new strategy so people understand what we're trying to do and what the bottlenecks are. So it will be very important because we've had a lot of questions on this, a lot of issues in the media. Everybody is shouting, test more, test more. So we'll tell the world what we're doing, what the limitations are, and if you have a solution, please come and help us. There are many well-meaning Nigerians that are now helping to do this. The private sector is really trying to unlock some of those bottlenecks, the CanCovid group, and bring in those things quicker than we might be able to do so as part of government. But there's a lot of effort at that level to do this. So thank you.
Thank you. So I have 4 questions. The first one has to do with the issue of the ports and inability to clear goods. So the PTF is certainly quite aware of the importance of making sure our economy continues to function during this lockdown. We cannot afford to strangle our economy and emerge in a much weaker position than we already are. We have been working closely with the Nigeria Ports Authority, and there were issues with ships I think about a week ago or so, but we've issued further clarification. The ports are not closed. It's just that there are clear quarantine regulations that we have to follow for seamen arriving in Nigeria within 14 days of leaving their destination. They will be quarantined, but if they have been at sea for 14 days or more, they will not, provided they have not stopped at a port or country with a high incidence of COVID infection. So that's sort of been sorted. There might be other issues to do with access to banks, etc., and we continue to work with the finance sector to make sure that funds are available and the banks are working, even if it is skeletal services, to allow the economy to drive on. The other issue has to do with school, the use of isolation, the use of schools as isolation centers. Yes, we have to be pragmatic traumatic. In terms of our opinion at the PTF, we continue to encourage state governments to be creative, but also to try and set up structures that are more sustainable and that can be of benefit to the health system after the pandemic. If a school is used as an isolation center, then obviously after the pandemic, I am sure there will be processes in place to clean the school and allow the school to function again. In terms of security, again, I will emphasize the presidential directive that included exemptions for media people. If security people are not respecting this, then we will take it up with the IG of police. But there are clear-cut guidelines. We've also issued protocols and guidelines with regards to the exemptions. And media are definitely within that group. In fact, not only media, also newspaper vendors, I believe. Finally, the issue of representation. We've had a lot of requests from the general public to join the PTF. The PTF is a strategic group that was formed by Mr. President. The membership itself was carefully selected, but we do have separate layers under the technical working groups. And as far as I know, a lot of the technical working groups have members drawn from various professions. We have doctors, we have pharmacists that deal with logistics, we have engineers, we have security people, we have civil society. Virtually almost everybody within our community are represented. But I can understand the need for specific associations to be involved, and we will be considering this. Thank you.
Honorable Minister of Information and Culture.
If I recollect, the question is whether the members of National Assembly are sharing 600 million or 700 million. Am I correct? Well, like I said, just as we are trying to contain and fight coronavirus, a lot of energy is also being expended in fighting fake news. To the best of my knowledge, I'm not aware that any such money has been given to members of National Assembly. But I know that the fake news is not abating. This morning, there was a message that went viral to the effect that one of the Chinese doctors tested positive. And that news was supposed to have emanated from a Twitter handle of the federal government. I want to say, to the best of our knowledge here, there's no such thing. I've just received also 2 hate dramas and other fake news while I was sitting down here, which I've been unable to open. But I think we will continue always to debunk fake news, and we'll try our best to timelessly give you information development about fake news. About COVID-19, either through our daily press briefings or through this website of the NCDC and the task force. Thank you very much.
Finally, we take the SGF.
I think the questions have been answered by my colleagues, but let me just deal with 1 or 2 here. Somebody asked whether I'm aware that people are resisting the lockdown, particularly in Delta. Well, the decision for the lockdown by the president had a direct reference to 3 locations: Lagos and Ogun states as well as the Federal Capital Territory. But the subnational governments equally have a responsibility over their territories, and some of them have signed the same quarantine declaration. And I think Delta State is one of them. And the Delta State governor had even imposed his lockdown before the federal government did its own, and did grant an extension of 2 weeks, I think, even before that of the federal government, meaning that we are working in sync with each other, between the federal government and the state governments, to ensure that we preserve the wealth and the health of our people. The president himself had alluded to the fact that it's a difficult decision, it's a painful decision, but it is a decision that must be taken in the interests of the people of Nigeria. We are mindful of that. We are cognizant of the fact that our social life has been disrupted by the lockdown in the entirety of this nation. But our constant appeal to the people of Nigeria is to see the long-term gain that will come out of this temporary dislocation in our communal life, and to try everything humanly possible to accommodate these processes that have been put in place for the overall good of all of our people. And I believe this appeal should be received with the best of intentions. That, like Mr. President rightly said, we should not allow the recklessness of a few of us cause the death of several of our people. And we live in an interconnected world. The world has become a global village. We are not operating in isolation. We see what is happening all over the world when it comes to how governments have reacted. Some governments have been on lockdown in the last 1 month, and they are not even thinking about lifting the lockdown. Everybody is looking at extending it so that the gains of flattening the curve, of interrupting the transmission that has permeated their communities, is dealt with. So this is not the time to encourage a resistance to the lockdown. This is a time to appeal to our people to respect the adversaries that have come out from the health experts and from the governments of the state and the government of the federation. The issue of banks shutting down and not allowing for processes of payment of duties, excise, and tariffs of all forms. I had a discussion with the governor of the central bank, I think the day, was it yesterday, the day before yesterday, where I also have received this report. And you remember when the president signed the declaration, the first one, there were exemptions and protocols that were issued under the signature of the governor of the central bank with the Minister of Finance, Budget and National Planning, where they prescribed how the banks were going to operate, mindful of the fact that we can't shut down the economy. People will have to access money, and transactions online should continue. But I even understand that the governor of the central bank went further to allow banks to open. I understand in Lagos there are banks that are open because most of our sports they are either in Lagos or in Port Harcourt. And Calabar. But the ones that are really active are the ones that are in Lagos. I understand the banks open between the hours of 9 to 2, particularly in the Apapa area, where much of the transaction in the seaports are undertaken. And I believe that we will go further to discuss with the governor of the central bank to see, because if they don't pay their custom duties and other charges, even with the exemption of the seaports, because there are our entry points that have been exempted in terms of activities, because a lot of our cargo shipments come through the seaports. There could be medicines, there could be food items, and other things that are essential for the survival and existence of our people that are contained in those cargoes. So that was the reason why Mr. President allowed, particularly in his first declaration, that Lagos Seaport will remain open, but be guided by the specific quarantine processes and protocols that were put in place. I understand the difficulties that our importers and exporters are experiencing. But I understand from the Executive Secretary of the Nigerian Shippers Council that discussions are ongoing between the Shippers Council and the shipping companies as to looking at the prospect of either an entire waiver of the demurrage or a partial reduction in the amount of demurrage that are expected to be paid for delayed cargo. So that is ongoing. And he has assured me that a decision or an announcement to that effect would be made in due course. So we are doing everything to engage with the business community, with those that are involved in the shipping, and with the Nigerian customs to ensure that everything that has got to do with fighting this pandemic is accelerated in such a way that that does not become a limitation for our effective dealing with this particular pandemic. The issue of representation, Dr. Sani Aliu, the national coordinator, has dealt with that. I've never seen a committee that everybody must be represented in. There must be a strategic committee or a group. In the wisdom of Mr. President, the 13 of us that are members of the Presidential Task Force have been assigned the responsibility of evolving a multi-sectoral response to COVID-19. We have doctors, we have lawyers, we have security personnel, we have administrators, we have people from different backgrounds that are working in this particular Presidential Task Force. But in addition to that, we have created another level of working committees, which Dr. Aliu spoke about. And the responsibility of these working committees is to formulate, articulate positions, also engage at every strata and evolve things that is sent for the consideration of the Presidential Task Force. So it's an apex body, but has branches all the way to the bottom in a pyramid form. So I believe that for every association or group that seek to have a place in this national response, we would have accommodation, but it might not necessarily have to be in the task force. There are other arms of the task force where people can find satisfaction to operate. Thank you very much.
Thank you very much, SGF. And, that brings us to the end of today's national briefing. I join the SGF in appreciating members of the press for your patience. And I also bring you two messages coming out of today's briefing. The first is that please, if you test positive, comply with invitations to isolation centers. It is the best path to care and management. Let us keep hope alive and let us overcome this together. The second message is that now that the policy on masks is out, please follow the guidelines on the use of masks for mutual protection. Remember, it only complements other measures. Maintain personal hygiene, keep safe distance, stay at home if you don't have to go out, and God bless us all. Thank you very much.